Hello, this is Health and Longevity with Dr. Rwende. Welcome to Monday Mornings, a platform that will be answering your questions that you are bringing towards through various platforms. And the question that I'm going to answer today is a 25-year-old lady who says, "Doctor, I'm having severe period pain which is not going away with the usual medication." So to answer that and to help everyone else, I'm going to talk about the topic of period pain. In Shona, Jeko, Indebele, Islumo. So this is a pain that is expressed during the menstruation. So how does this pain come about? So naturally, the womb or the uterus is made to receive a baby to get pregnant. So what happens every month is preparing itself for a pregnancy. So what it does is every month is cleaning itself, and in that process of cleaning itself, the body produces some chemicals which are called prostaglandins. These chemicals, they squeeze the womb so that it removes those dead bodies for preparation of the next pregnancy. And that process of squeezing is the one that causes period pain. So generally, we usually put it into two groups. So we usually put it into either primary period pain or secondary period pain. And the medical name for period pain is dysmenorrhea. So we usually say primary dysmenorrhea and secondary dysmenorrhea. The primary one is the natural one, the one that's usually experienced by most women. It does not have any cause, it's natural. The secondary one is the one with an underlying cause, usually due to pelvic inflammatory disease or endometriosis. So the primary one, like I said, which is the natural one, who is at risk of getting that one? More than 50% of women, they have this one. And it's usually common to those who have their menstrual period before 12 years of age, and those who have a family history, and those who haven't had their first child. So how do we treat this one? This one is simple to treat. Usually medication like diclofenac, brufen does wonders. But of course, this medication is not for those who have peptic ulcer disease or what we commonly call ulcers. For these ones, we encourage them to take medication like celecoxib or even paracetamol. So how do you prevent this one? Generally, since this one is natural, we can't really prevent it. But according to studies, it has been shown that regular exercising reduces the intensity of this pain. And of course, naturally, this pain goes away as you get older and older. And of course, again, to some people, when they get their first child, this pain goes away. Now getting to the secondary dysmenorrhea, the secondary period pain, which is likely to be the case of our sister. And this one, like I said, there's usually a cause that's behind, and the commonest cause is endometriosis. So for this one, how do you know or how do you suspect that you could be having a secondary dysmenorrhea? So the first thing is this pain will be coming in your 20s and 30s. And again, also people who be having difficulties in getting pregnancy, you must suspect that one. If you're having vaginal discharge or pain during sex, and also those like our sister who will be not responding to the usual medication like the diclofenac, the brufen, you must suspect that it could be having a secondary dysmenorrhea. For this one, you need to visit a gynecologist. That was all for today. Thank you very much. Again, until we meet next time, don't forget to subscribe to our YouTube channel and like our Facebook page, Dr. Rwende.